is your first spotter. Okay. So you have to write the answer in the comments, like what is the answer of 1A and then what is the answer of 1B. Okay. Okay, so it's very easy that there are three malleoli which are involved here. Okay, it's simple. So the common name which very commonly we use is the trimalleolar fracture, and the special name which is given to this is not POTS, it's actually your Cotton's fracture. Okay, so now what knowledge do we gain? That the anatomy knowledge which we have gained through this is that there are at least three malleoli. So somebody who's not aware about that there is a third malleolus, which is the posterior malleolus, and the spotter part is the special name which is given to this fracture. It's basically the cotton fracture. Okay, so this is how you should remember the spotters and try to gain every point from that. So like this is the discriminatory point. Okay, and this is an example. Wherever the posterior malleolus is involved, it indicates ankle instability and usually necessitates your surgical fixation. Okay, so we'll focus on the spotters. We'll deal with the doubts later. Okay, so this is the spotter number 2. Okay, so the first part deals with the anatomy. The second part deals with the spotter part. Please give the answers step by step. Okay, first tell me what is the answer of 2A. So this part is basically being commonly involved, that is the distal articular surface. Okay. So what do you call this part? We call it as tibial plafond. Okay. Yes. Which Tilloch's fractures are seen in adolescents. Okay. They are seen in skeletally immature patients. Okay. So the special name which is given to this fracture is the Pylan's fracture. Okay. So it is a comminuted intra-articular fracture of the distal tibial plafond. Okay. It's usually seen in high energy axial load injury. Okay. Yeah. Now you have to tell me what parts of the bone, firstly, they are involved by this fracture. Okay. So the parts of bone include your diaphyses, metaphyses, like that. Yeah. And what is the type according to its Salter Harris? The 3. So the first part answer is actually involves the epiphysis as well as the physeal plate, but not extending up to the metaphysis. Okay. If it would have extended to the metaphysis, it would have gone into Salter type 4. So this is a Tilloch's fracture. So this is a Salter Harris type 3 fracture of distal tibia, usually seen in adolescents. Okay. And it requires anatomical correction so as to prevent, it requires surgical correction and anatomical reduction to prevent ankle arthritis. Okay. So no metaphyseal fragment, which helps to differentiate whether why it's a type 3. Okay. So it's a vertical intra-articular fracture line going through physis as well as the epiphysis. Okay. So you just have to name the structure marked with the arrow. So first 3 were a little difficult. Now we are moving on to certain easy ones. Correct. So it's os trigonum because we do not see any communication or any bony association with the posterior aspect of talus. If there would have been, it would have been called as Tidas process. Since there is no communication, so this is os trigonum. Okay. So well corticated ossicle posterior to the talus. Very important point which you need to remember: smooth round margins. But because if it would have been irregular margins, we would have thought it to be a fractured Tidas process. Okay, so smooth round margins in this case, they favor the os trigonum. So it should not be mistaken for a posterior talar fracture on ankle radiographs. That's your pearl for today. Yeah, next spotter. You have to just mention what is the bony part which is marked by the white arrow. What we call it as. Okay. So let me make it easy for you. So this is the calcaneal bone. This is your peroneus brevis tendon, and this is your peroneus longus tendon. So there's a structure on the lateral aspect of the, there's kind of a prominence on the bony prominence on the lateral aspect of the calcaneal body, separating the tendons of lateral compartment of ankle joint, which are your peroneus brevis and peroneus longus. So what do we call this bony prominence? So no answers for this. So this is your peroneal tubercle. Yes. Okay. So important point is if there is a hypertrophic peroneal tubercle, it can cause peroneal tendon impingement and can lead to lateral ankle pain as well. Keep giving yourself points. Okay. And at the last, I'll be asking you the total score. Okay. You just have to name the tendon which has been marked by the white arrow. Okay. T is for talus. This is your anterior part and this is your posterior part. No. So do we see three tendons on the lateral compartment? Okay. So even if I've not told you medial or lateral sides, you see that there are three tendons which are lying on this side. Okay. So we know that there are three tendons in the medial compartment and two tendons in the lateral compartment. Okay. So this is definitely your tibialis posterior tendon. Okay, so important thing, 1 point for you is the dynamic stabilizer of the medial longitudinal arch. So whenever there is a tibialis posterior tendon dysfunction, the medial longitudinal arch of the foot will collapse, leading to flat foot deformity.